The Minister of Health, Nicole Donnelly.
Mr. Speaker, question 1, please.
Thank you, Mr. Speaker. The Belfast Trust recently completed the multidisciplinary review of the options for the remediation works required to address the water safety issues within the new maternity hospital at the Royal Victoria site. The review has been in the form of multidisciplinary risk assessment workshops held in April and May. The intent to determine the route forward for the building and the level of remediation works required to give assurance of safety. A recommendation on the option to be implemented was discussed and accepted at Trust Board level. That was on the 5th of June. The Trust provided the Department with a briefing document only last Thursday. This outlines the proposed remediation works to be implemented, and it includes a programme for the remedial works and estimated costs for same. I and my officials are reviewing the document. I've already met with the Trust Director of Strategic Development to try to satisfy myself that everything possible is being undertaken by the Trust to allow the maternity facility to become operational as soon as possible while ensuring patient safety. There are a number of issues with the report and proposed way forward where my officials and I have tasked the Trust to come forward with further information. I can understand why there is a genuine desire from the committee to receive this report, and once next steps are determined, and hopefully will be very soon, I want to assure members the document will be shared and officials made available to brief the committee as required. Belfast Trust have assured me the safety of patients remains our highest priority when addressing the water safety issues within the new hospital. I support this position. In this regard, I can advise the Trust have confirmed they'll establish a robust flushing management and testing regime for the water systems during and after the remediation works. The management of this regime to ensure patient safety will need to be closely monitored by a dedicated Trust Project Water Safety Group.
Mr. Donnelly.
Thank you, Mr. Speaker, and thanks to the Minister for his answers so far. This has been a long developing issue, and I'm glad to hear the Minister is going to share that report with the committee. It's 10 years behind. The cost is now expected to be more in excess of £97 million, and with this I expect there will be a price tag as well. So I'd like to ask the Minister about the price tag and if he knows when mothers will be able to have their babies in the Royal Maternity Hospital.
Thank you, Mr. Speaker. Well, first of all, there has been no decision endorsed by me. There were 3 options, and I know that the Trust are going for option B, and that appears to have a timeline, and I'm sorry to say this, a timeline of 28 months. That's another 2 and a bit years, and several £million. So I have met with, as I said, with the relevant official. I have not accepted this. I can't gild this lily. I can't soften this. None of the 3 options can be guaranteed to solve the problem. None of them. The third option is to rip everything out in terms of the waterworks and start again, and that's going to take even longer. So what I've done is I've asked that we find an external expert, because when the multidisciplinary team looked at the 3 options, the majority went for option B or 2, but not everybody. So first of all, I would like an external view on this, about whether B or option 2 is the right option. I want an external view in terms of whether it really should take 28 months. I also want to know whether there are parts of the hospital that we can start using while we're fixing the water, because the area of real danger is the neonatal unit, as you know, where the most vulnerable children are. And I also feel I need to better understand from those who were against option B why that is the case. So we're far from I am far from finished on this, but there's nothing good to say except it is a magnificent facility that is not in use.
Nods.
Speaker, I must say, I think everyone in the chamber shares your frustration. 28 months, and we're already 15 months since the handover of that building. So I share your frustration. Can I turn your attention, Minister, to another issue in relation to the Belfast Trust? And can I ask you to explain to the House how significant the fire safety concerns that the Northern Ireland Fire and Rescue Service have about the Royal Victoria Hospital. Do you know when the Trust was first advised about these concerns? And can you confirm that the Fire and Rescue Service is pursuing an enforcement notice in relation to this?
Minister.
Thank you, Mr. Speaker. A different issue, as the member says. So a fire safety audit was carried out at the Royal Victoria Hospital on the 4th of June, and that was by personnel from the Northern Ireland Fire and Rescue Service. They did so under the Fire and Rescue Service's Northern Ireland Order of 2006. The outcome of the audit found a substantial risk at wards 4 and ward 7, with a score rating that falls within the enforcement notice category. A follow-up meeting took place on the 11th of June to assist the Belfast Trust in making the necessary improvements. Another meeting is arranged for this afternoon. I appreciate the pragmatic approach that the Fire and Rescue Service takes to working with responsible persons at audited premises to mitigate risk. And in this case, the Fire and Rescue Service inspection officers continue to do so with the Belfast Trust officials. But I accept the point that this does nothing to try and restore public and political confidence in the Belfast Health and Social Care Trust.
Alan Chambers.
Thank you, Mr. Speaker. Minister, in relation to the neighbouring capital project on the Royal site, are you satisfied that works are progressing well with the new Children's Hospital?
Mr. Speaker, thank you very much. I can say to the member that I am satisfied with the verbal assurance I got as recently as yesterday that work is progressing on the Children's Hospital on time and to budget. But that said, we are in the foothills of a very long building works campaign. I am happy to report the Falls Road has not collapsed, and I don't say that flippantly, but there has to be work carried out in the first instance to ensure that that road is shored up, and that appears to have been done successfully.
Linda Dillon.
Can call you, and can I apologise, can call you, for not being in my place yesterday. I thought my question had been withdrawn, so apologies. Minister, thank you for your response so far. Can you just give us an idea if the works at the new maternity hospital will be borne by the public purse, or whether there is an ability to get that money back from the contractor in any way? And if you don't know that, when will we know the answer to that?
Minister.
Mr. Speaker, thank you very much. I understand the member is very curious about this, as indeed am I. We are, as I understand it, the Trust are still trying to figure out exactly what has gone wrong with the pipework. So we know there was Pseudomonas bacteria in the pipework, and that has been the main issue. But I understand since then that some valves which have seals are perhaps defective, and there's now a question about whether that is the responsibility or where that responsibility lies. It's commercially sensitive, so I don't want to not be open and transparent, but I don't want to say anything in this chamber that might prejudice anything the Belfast Trust feel they need to do in terms of liaising with the contractors.
Paula Bradshaw.
Thank you, Mr. Speaker. An earlier independent review identified the model of the proposed 6 or 7 bedded mother and baby unit should be that as recommended by the Royal College of Psychiatrists, and additionally that the location of the mother and baby unit should be the City Hospital site, which of course is within the Belfast Health and Social Care Trust. I've already made clear to officials within my department I wish to see this issue progressed at pace, which would be a change. However, given the importance of the service, the latest position is that public health colleagues have been asked for their input to strengthen the case for a 7-bedded unit, which will help make the unit future-proofed. Belfast Trust are at a very advanced stage in the development of a capital and revenue business case. They've advised once they receive instruction on the number of beds required, it will take 6 weeks from there to finalise the business case. Now, while the development of a mother and baby unit remains a longer-term strategic objective, my department has committed to strengthening existing provision in the interim through investment in community-based specialist perinatal mental health services, the upskilling of perinatal clinical staff, the implementation of the perinatal mental health care's pathway and the associated guidance, implementation of crisis intervention pathways and out-of-hours support for women experiencing acute distress, and finally, ongoing engagement with service users and advocacy groups to ensure care remains person-centred and responsive to the needs of mothers and families. Development of a survey user leaflet to explain the perinatal mental health is underway.
Ms. Bradshaw.
Thank you, Mr. Speaker, and thank you, Minister, for your answer. I wonder, thank you for the details of what's happening in the interim, but going forward, have you had any discussions with your counterpart in the Republic of Ireland to see if there is the ability for an all-island approach to this? Thank you.
Minister.
Mr. Speaker, thank you very much. I can say to the member, yes, I have, and in fact it was with the previous Minister for Health in the Government of Ireland, Stephen Donnelly. We had some detailed discussions about the possibility of pitching to the Shared Island Fund for a single mother and baby unit that would service the whole island of Ireland. Without wishing to break any confidentiality, the response from the Shared Island unit, according to Minister Donnelly, was a hard no. So we have that perhaps explains part of the delay in that we were hoping to go down that route. But that's over, and now we must press ahead at pace and get this done. My wife could have used that service 30 years ago.
McGrath.
And Minister, notwithstanding all the good work that you're saying that's taken place in lieu of there actually being a mother and baby unit, has any consideration been given to providing a temporary unit? Because most of the backbone of the work is the staff, and whilst we wait to get the perfection of a brand new building and a new service, maybe actually just something even temporary, because we're waiting on the Belfast Trust delivering this. It could be a long, long time before it actually arrives.
Minister.
Thank you, Mr. Speaker. I will go back and check once again with officials whether a temporary solution is possible. I just said to the member, it's now over 30 years ago that my wife had an episode of antenatal depression. And what happened when my son was born was so far from ideal, it has stuck with us 30 years on. So until we get the mother and baby unit, we're not going to be in the position that we need to be in. Temporary solutions sound good, but then when you get into the practicalities of it, but I will ask and I will get back to you.
William Irwin.
Speaker, question number 3.
Sure.
Thank you, Mr. Speaker. Encompass successfully went live in the Southern and Western Trusts on the 8th of May. This is the first time in the history of Northern Ireland that all 5 geographically defined trusts have been integrated into one digital system. It's a major transformational change. It will empower patients. It will improve access to care. Used properly, Encompass will deliver improvements to care quality and to productivity. It will ensure staff have timely access to health information while supporting safer and more effective care delivery. Encompass is Europe's most comprehensive digital care record, comprising acute, community and social care, social work and mental health care. With the system now operational across Northern Ireland, all patients and service users will be able to securely access a subset of their health record, such as clinical letters, medication details, and some test results via the MyCare patient portal. They can also view appointments and track the progress of their treatment. MyCare is already providing secure access to personal health information for over 150,000 users. The Encompass system also offers seamless sharing of patient and service user data with authorised colleagues across the health and social care network. Key integrations include systems for routing letters, imaging and lab results to GPs, ambulance booking and arrival management services, also regional radiology and digital pathology services, and the Northern Ireland Pathology Information Management System for laboratories. Encompass continues to collaborate with senior Trust Information Risk Owners, the Information Governance Advisory Board, the Information Commissioner's Office and other key stakeholders to ensure benefits are being realised right across the region within the framework of continuity of care, patient safety, information governance and cyber security.
Mr. Irwin.
Can I thank the Minister for his response? Minister, now that Encompass is in all the trusts, can you ensure that this House that we will now get full information on waiting lists, particularly cancer waiting lists where key data has been absent?
Minister.
Mr. Speaker, thank you very much. the fact is that rolling out Encompass is one of the biggest changes to patient record keeping that the staff, the workforce of the health and social care system have ever had to face. It needs a period for bedding in, and it needs a period for validation. So frustrating as that may be, there have been times, and there continue to be times, particularly with the Southern and the Western, the latest trusts to adopt and go live with Encompass, when the information and the data we're getting is not fully validated. This is just part of the process, and I say again, it is frustrating, but think of the prize once we get there, when it is fully embedded, operational and validated. Its impact on our ability to deliver public health is unmatched, and so I think we're in a really good position going forward.
Philip McGuigan.
And I note the Minister used the phrase, think of the prize when Encompass is fully embedded. Subsequent to that, can I ask the Minister to outline what discussions he has had with GP representatives to determine what level of access to Encompass they require, and if he can outline any progress on the discussions?
Thank you very much, Mr. Speaker. The GPs, as the member will know, do not have full access to Encompass. But it is my understanding from talking to the officials who are in charge of this that they have sufficient and appropriate access to Encompass. Where we go longer term in the future is something I'm very much open to, but I'm satisfied that at the moment GPs have appropriate access to the information they need, which is being held now on the Encompass system.
Justin McNulty.
At a price tag of £300 million, Encompass really should be all singing and dancing. And in relation to GPs, it is disappointing that GP information is not stored on the Encompass system. So in terms of the integrity and efficiency of the service and health services, it should be all included. Have you any concerns in terms of the teething issues around Encompass, whereby there's an overburdening on staff, and some feel that they are now moving from paperwork to data work?
Minister.
Thank you, Mr. Speaker. I didn't catch that last, from paperwork to data work. Well, I have been out and about a lot, as the member may know. I visited a lot of sites, particularly hospitals where Encompass is in use, and I do get a mixed reaction in terms of asking people, what do you think of Encompass? I've had some extremely negative comment, which I will not repeat within this chamber, but I've also had some particularly encouraging responses, and the encouragement tends to come more from clinicians and consultants than people who are perhaps, as you put it, moving from paperwork to data work. But look, yes, £360 million is a lot of money. We reckon the cash releasing benefits of this will be £29.6 million over the next number of years in cash terms. Non-cash releasing benefits, I am being told, will be of the value of £514 million. But it's not about the money. It's about the ability to deliver public health, to understand much better where the problems are, particularly health inequalities, to be able to analyse where health inequalities occur, and then to go in and proactively tackle them.
Stuart Dixon.
Minister, and while we appreciate all the benefits of Encompass, there nevertheless remains, particularly in primary care, a mishmash of systems that have either been procured by GP practices or others across the healthcare system. In England and Wales, there is a major project underway now where that previous technology was very difficult to draw together, and there are now excellent technological solutions to bringing it all together into central systems. What action are you taking to do that?
Thank you, Mr. Speaker. I see that as part of a next phase. As the member said, £360 million is an awful lot of money. To fully roll it out across primary care is beyond our ability in terms of our financial reach. But I would say to the member that the thing that I want to see next is e-prescriptions. I want to see GPs being able to prescribe over the internet. So, I mean, I take 5 tablets every day, so I go to my chemist. My chemist tells me, my pharmacist says they have to walk up the hill to the GP practice, physically collect the docket, come back, process it. I think for primary care, for GP surgeries, and for the pharmacies, if we were able to do this electronically, it would be transformational. And yet I'm told it will be 2032, 7 more years. Again, that doesn't equate to my sense of where is the urgency in healthcare delivery? How are we doing things at pace? So while Mr. Dixon is validly pointing out that there's an issue that needs to be addressed, the one I really want to address next is that electronic prescription.
Mark Durgan.
Thanks, Mr. Speaker. Question 4.
Thank you, Mr. Speaker. Implementing the new Regional Mental Health Crisis Service is a commitment in the Mental Health Strategy for 2021 to 31. It comes under Actions 12 and 27. My departmental officials and the Public Health Agency are working in partnership to deliver on both of these actions, with the hope of developing a regional mental health crisis service for all the citizens of this place. Future state work has commenced across lifespan services, including scoping what a good service would look like. As part of the development of the Regional Mental Health Crisis Service, my departmental officials are keeping national developments, such as specialist crisis centres in NHS England, under review. While some individuals who are experiencing a mental health crisis require to have their needs assessed and met within an emergency department, others may not. As an alternative to ED attendance, 2 initiatives were piloted for individuals with mental health needs but not requiring acute physical care. There's the Multi-Agency Triage Team, or MAT, currently operational in 2 trust areas, and there's the Northern Ireland Ambulance Service pilot initiative called Hear and Treat, operating in the southeastern area, which includes mental health professionals in their control rooms.
Mr. Durkin.
Thank the Minister for his answer. Will the Minister concede that in many aspects the current model serves nobody particularly well, be it those suffering mental health crises, other vulnerable, particularly elderly patients having to endure the sometimes volatility of some of those with mental health issues, and not least the overstretched staff who put themselves at risk often trying to manage this situation as well as administer care to all those in need. Does the Minister envisage that this regional mental health crisis service will be adequately resourced and will be equally accessible to all across the North?
Minister.
Thank you, Mr. Speaker. Without wishing to scare people, I mean, the question, will things be adequately resourced, tends to end up with the answer, it could be much better resourced, which is not to say that there aren't good resources out there. The member will know I've campaigned on mental ill health and well-being since I was elected back in 2011. I don't think it's a Cinderella service anymore, which it was back then. But there are 2 issues. One is awareness and the other is action. And I think we've done a lot more in terms of awareness than we have done in terms of action. And to do more in terms of action, yes, we need more funding, we need more resourcing, but we also need workforce. And I say again, to deliver healthcare, you need buildings, you need beds, you need equipment, you need medicine, but all that says nothing if you don't have the right workforce, and that's in terms of the numbers, the skills, and the commitment. And that's where my primary focus is. And we need to do more in terms of delivering these services for people who are incredibly vulnerable because of their mental conditions.
Neil McAllister.
I thank the Minister for his answers so far. Minister, in my constituency at the Mater Hospital, if you go down any evening, you often find many police officers, many staff, many patients in crisis. The staff at the hospital know they need help, they want to give them help, but the approved social workers, GPs, their workload is very intense, but yet there are people falling through the cracks. What can the Minister's department do for interim measures before we have these crisis centres established, so that those hospitals that are often overwhelmed can actually get the help that the patients need?
Minister.
Thank you, Mr. Speaker. So the member mentions the fact that there are PSNI officers in the Mater Hospital, as indeed there are around the EDs in all our acutes. The member will be aware that the Chief Constable, Mr. Boucher, is planning to move the PSNI into the right care, right person model, following an approach that is already underway in other parts of the United Kingdom. The reason for that is he will argue, quite rightly, that PSNI officers are not trained to deal with many mental health issues. So we have been working with the Department of Justice, with the PSNI, as a Department of Health. I understand the direction of travel is the one that we need to pursue. My only concern is with regard to transition. I don't want to see a hiatus where there is nobody around to try and deal with vulnerable people who have severe mental health and well-being issues and could be a danger both to themselves and to others.
Dan Armstrong.
Thank you, Mr. Speaker, and thank the Minister for his answers to this point. Minister, can you provide an update on the very impressive mental health community navigator service within the Royal Victoria Hospital A&E department?
Well, I thank the member for her question. As far as I understand it, there are ongoing discussions with regard to the future of that service. All these services are shown to be of benefit to patients, particularly vulnerable patients, perhaps patients who don't know particularly well how to navigate a hospital like the Royal Victoria. But funding is always an issue. So I think the best I can say to the member is that no definitive answer is forthcoming today, but negotiations are underway with a view to trying to maintain that service.
Orlea Flynn.
I'll get question 5, please.
Thank you, Mr. Speaker. I'm aware of the outline proposal put forward by Queen's University Belfast for a trialling rapid drug testing model here in Northern Ireland. Following recent conversations with interested parties, including Queen's, the PSNI and the Public Health Agency, the intention is that enhanced testing possibilities will be fully considered as part of a wider anticipated review of the current drug and alcohol monitoring and information system. While the extremely challenging financial situation remains, funding for any enhanced testing service is unlikely to be available in the near future. However, we'll continue to monitor the position and we will seek to identify other potential funding sources should the review of the information system indicate this type of approach would be helpful locally. It's important to note that the Drug and Alcohol Monitoring and Information System, operated by the PHA but overseen by a cross-departmental steering group, continues to provide up-to-date information on substances of concern to service users and those likely to come into contact with potentially harmful substances. Under DAMAS, currently we have the ability to proactively seek rapid testing of substances which are seen to be causing harm through partnership working with the PSNI and Forensic Science Northern Ireland. This information is used to inform related advice and give alerts to service users, to vulnerable groups and those in key services. However, it doesn't provide for ongoing testing of a wider range of substances, and it's acknowledged that enhancement in this space may be useful. However, the exact requirements should be informed by the review. Subject to the completion of the review, resulting recommendations and securement of the necessary funding, it may of course be appropriate to consider whether other potential suppliers should also be invited to put forward proposals in this area.
Ms. Lynn.
Thank the Minister for that response. So I do think it's disappointing that that this pilot mightn't be successful. My question then would be, in terms of the review of that information system, does the Minister have a timeline when that review will be complete? And could one of the other funding options maybe be through the North-South Ministerial Council, the Health? I know we gave an update the other week around the all-island working around drink, alcohol and drugs.
Minister.
Thank you, Mr. Speaker. I don't have a definitive timeline for this work. It falls into a broader category. Indeed, yesterday I was with representatives from Belfast City Council talking about their complex lives proposals, which seem to work extremely well. And I have agreed that I will try and get a multi-departmental meeting with the Council about this alongside Justice and communities. So I want to place this in a broader societal context.
He's not available. Kelly Armstrong.
Number 7.
Thank you, Mr. Speaker. I want to assure the member work on the proposed changes to the legislation remains a key focus for my department, and I'm committed to ensuring this work is completed without undue delay. The public consultation on the proposed eligibility criteria for passporting universal credit recipients, it closed on the 10th of March. I welcome the openness, the feedback and the engagement from all who participated in the consultation. So officials are currently analysing the responses, compiling a consultation summary report which will be published on the departmental website in the coming weeks. In the context of the extremely difficult financial environment, implementing the existing GB thresholds remains the preferred option that will preserve parity with the rest of the UK. It's also most affordable to the health budget and will ensure continuity of eligibility for the most vulnerable.
That draws to a conclusion the time for the listed questions. We now move to topicals, and I call Colin McGrath.
Mr. Speaker, Minister, you'll be well aware of the serious issues facing the Belfast Trust, including persistent reports of bullying, racism and inappropriate behaviour. You've introduced level 5 interventions. Can you confirm whether this includes a mechanism that will allow staff who've lost trust in the Trust to report concerns directly to an independent body with confidence there that their concerns will be taken seriously?
Thank you, Mr. Speaker. I think I can say yes to that, but I want to be specific about this. In fact, after this meeting, before the day is out, I will be meeting with Peter McBride, who the member will know I have asked to be my eyes and ears in terms of assessing the adverse cultural and behavioural issues, not just in the cardiac surgery unit, but across the Belfast Trust. So I have some draft terms of reference for him. I wanted to consult with the unions again, because I've already spoken to them, unions and the professional bodies, and just to make sure they're content with the terms of reference. Obviously I want Peter to be content, but one of the specifics is the whistleblowing policy, because it is my understanding that service or staff confidence in that whistleblowing policy is very low. So I want to be assured that people feel that if they do whistleblow, that they will be heard properly, that they will not feel that they're putting themselves at risk of some sort of reprisal from management. I have no idea whether that is the case. But there's certainly, if you judge it by the reported level of confidence in that system, there's a problem. And where there's a problem, there needs to be a fix.
Mr. McGrath.
Thank you very much. Well, I welcome hearing that, Minister, because many in the Health Committee who heard from the Trust last week were less than assured that matters are actually being dealt with. When the Trust Chair refers to a complaint as potentially just a gripe, it made me feel that what we're actually saying is that the culture from the very top is not working within that organisation. Can I say, if level 5 interventions reveal a continued failing at Trust Board level, will you ask those responsible to stand aside?
Minister.
Thank you, Mr. Speaker. I would say yes to the member. I said I was going to intervene on a number of levels. Peter McBride going in to look at the culture and the behaviours where they're wrong is number one. Number two will involve putting somebody in externally who has an expertise in what I'm calling clinical teamwork, which is a direct reference to the cardiac surgery unit. My permanent secretary, Mike Farrar, is on top of that. It's one of the great advantages of having somebody steeped in healthcare delivery across the UK, that he knows names. So I've left him to liaise on that. There is a third intervention which I am working on, and I'm not in a position to reveal it, but I do assure you the House and the Committee will be first to know.
Question 2 was withdrawn by Mr. Blair, and I would inform the House that Mr. Blair tragically lost his father today. So I'm sure the sympathies of all of the House will be with John at this time. And I call Kelly Armstrong.
Thank you, Mr. Speaker, and thank you for your kind words. But could the Minister provide an update on the Department's plans for the regional review of neurology services, specifically any work ahead of the conclusion of the public consultation in August 25?
I thank the member for her question, and can I express my condolences to Mr. Blair on his loss. Neurology was one of those areas where we were looking at a really bad situation. I'm going to say, Mr. Speaker, I think I need to write to the member because I don't want to misspeak on such a serious issue.
Thank you, and thank you, Minister. When you're writing back, if you could confirm if there's any short-term measures that can be prioritised to improve access to neurology services in the interim.
I can certainly give that assurance, Mr. Speaker.
On Bunting.
Mr. Speaker, and I would also like to express my condolences to Deputy Speaker Blair. I've been in that position myself, and it is very, very tragic and very difficult to deal with, so I really send him my very best wishes. Could I ask the Health Minister to give his assessment of the effectiveness of the presence of medical practitioners in custody suites, please?
Thank you, Mr. Speaker. I understand the angle that the Chair of the Justice Committee is coming from. I have to say this is not an area that has been a focus of mine, so I'm more than happy to take it away and listen to whatever the member has to say by way of follow-up.
Ms. Bunting.
Thank you, Mr. Speaker, and I'm actually grateful for that answer. And I'd be grateful if the Minister would look into this, because we are hearing that there are actually more detained persons being sent to hospital than prior to this scheme. And moreover, that apparently those medical staff present and on site in custody suites will not help police officers who are suffering minor injuries in the course of their duties. So, for example, if they're cut or if they're spat at, they're being refused help. If this is indeed the case, then perhaps the Minister, when he's looking into this, could consider whether this is acceptable and what is his assessment of that, should it be the position.
Minister.
Thank you, Mr. Speaker. Just for the avoidance of doubt, I should maybe declare an interest in that my sister is a custody visitor. So she does sometimes give me a narrative of her experience. I mean, I think the bottom line is I thought that health and PSNI were getting a lot better in terms of understanding where people should be placed. So, for example, people with severe mental health issues should not necessarily be put in a holding cell in a police station. So you're taking it to a different level where there's kind of seems to be some sort of division of labour where people are refusing to offer appropriate medical support and intervention. So I most certainly take a look at that.
No, there's no giving way. You and the Minister can engage outside the chamber on this. Question 5 is withdrawn. Move to Ms. Melissa McHugh.
Margaret Concorla, and I'd like to express my deepest sympathies as well to John Blair and to his family at the loss of his father. Minister, my question to you is just in relation to the recent racist attacks and so on. Are you aware of, or have you had any assessment of the impact that has had on healthcare workers?
Minister.
Thank you, Mr. Speaker, and I thank the member for the question, and I have been public about this. While there is no evidence that we have received to date that any of the people who are subject to the racist attacks are our international colleagues working in delivering healthcare in the health and social care system, I am aware that last year several valued members of the international community in the HSE system did come under attack. I'm thinking about particularly a nurse in Antrim, but that was one of several. And whether any member of the health and social care community has been attacked or not, it is beyond logic that international colleagues will be feeling the fear and the intimidation and wondering, are we next? And let me be very clear, it is extremely well accepted within healthcare delivery that if we don't have our international colleagues, the healthcare system collapses. I repeat, collapses.
Mr. McHugh.
I thank you, Minister, for your statement so far. Minister, are there any measures that you can put in place just in the event of an emergency that there are healthcare workers that are coming under pressure as a result of the recent sort of experiences?
Thank you, Mr. Speaker. The answer to that is yes, but it's not the department, it is the Trust. And I can assure the member that last year the Trust had protocols in place to help international colleagues. Very practical things like international colleagues who were afraid to use public transport to get to and from work for fear of intimidation and potential physical attack. So there are very practical processes in place and reporting mechanisms where individual members of our international community can alert trusts to the fact that they are concerned, that they're fearful, that they're feeling intimidated. So I have no particular concerns that it's not being treated with the utmost seriousness by the 5 geographically located or defined trusts, and that those processes are in place.
Peter Martin.
Thank you very much, Mr. Speaker, and can I also send my condolences to John? I did know his father was unwell, but I'd want him to know that I'll be thinking about him and praying about him in the days ahead. Can I ask the Minister what action he's taking regarding the fact that over a third of consultant haematology posts are currently vacant in Northern Ireland?
Thank you very much, Mr. Speaker. Well, as I said earlier in this session, to deliver healthcare, you need buildings, you need beds, you need equipment, you need medicines, but that is all as nothing if you don't have the right workforce. So the member is identifying just one of many, many, many areas where we have vacancies, too many vacancies to the point where the delivery of better outcomes for the patients who need them are not there. So we do have a workforce directorate, and it is their responsibility to take the necessary steps in conjunction with the Trust to try and improve those rates of vacancy. Because what I don't want is people not receiving timely and proper attention when they need it.
Mr. Martin.
I want to thank the Minister for his answer. Minister, what are the particular pressures and difficulties that the health service in Northern Ireland face in regards particularly to recruiting consultants across not just haematology but across wider specialisms?
Thank you, Mr. Speaker. Well, I think there are a number of factors which mitigate filling all those vacancies. One is location. I think it's well understood that some consultants are unwilling to travel to some of the furthest away points from Belfast, because Belfast does become that kind of mecca or that magnetic centre point for the delivery of healthcare. And in some ways, it has to be that way because the Belfast Trust delivers so many regional services for the whole of Northern Ireland. The other big concern is that we used to worry about consultants and others, nurses, allied health professionals, going to Australia, for example. Now we have to worry about them going to Athlone because the rates of pay under Sláinte care are much more attractive to people. So what we have to do, if we cannot compete on salary, is look at the other terms and conditions, the working conditions, the work-life balance. Those are the things that I want to focus on to try and make these roles as attractive as possible and therefore attract people in and, importantly, retain them within HSC.
Bill Brownlee.
Minister, just in reference to your statement on GP contracts, you detailed some very small but obviously important changes to improve access, such as pre-bookable slots so that patients don't need to continue to call back. Minister, could you detail what further discussions have taken place in this regard?
Minister.
Thank you, Mr. Speaker. Well, as the member will know, the BMA, beg your pardon, the BMA GP committee did not like the contract offer that was put to them this year. They wanted another £80 million, as well as other measures to look at things like indemnity, national insurance contribution hikes, and the rest. I was disappointed that we couldn't go on to discuss in any great detail access arrangements, so the member is aware we put some relatively modest proposals to them which could be implemented at no cost. Rather than, we are not getting into a big detailed discussion on that at this stage, but what we are doing is moving on to discuss with that committee a new model of the delivery of primary care. And I think that opens up all sorts of potential, not just for further investment in primary services. And I say again, I want to see a shift left. and that's into primary care, community care, social care, taking the emphasis off the acute hospitals, trying to make sure they don't have to do as many of the really high-cost procedures, and that's going to start a money flow, a funding flow towards GP services.
That brings us to a conclusion, the time for questions to the Minister. I have been doing a running note, Minister, on how many supplementary questions are answered. The best so far is 27, 19, 2 16s and a 14. So today you're the 14. I just encourage ministers to mix the need for detail in answers to questions with the ability to be succinct, and encourage maybe their civil servants to be a little more succinct in all of that. But thank you. If members take their ease, we're going to hand over to the Principal Deputy Speaker.